Mrs. Schaefer?
Hi.
Hi, I'm Ellen. I'm their nurse practitioner. I'm going to be doing 3 different assessments on you today.
Okay.
What would you like me to call you?
You can call me Rhonda.
Okay, Rhonda. So to start off, we're going to start with the cardiovascular exam. So I'm actually going to have you remove this one pillow from behind your head just so that you can lay back a little bit more,
Sure.
Okay? So for the start of my exam, I'm just going to have her laying here normal like this, and I'm going to have her turn her head to the left a little bit, and I'm going to assess her carotid artery here on the side of her neck. So go ahead, Rhonda, and look to the left for me. And so in a normal circumstance for the exam, I would be doing this from both sides, but just since the scenario we're in here, laying in the bed, I'm just going to do it from the right side first. So I'm just inspecting her carotid artery. I'm not seeing any pulsations, any jugular vein distension, anything like that. So I am going to palpate. Now I'm not going to palpate right underneath here by the carotid sinus. I'm going to go a little bit lower than that. So Ron, you're just going to feel my hands touch right here. I'm going to feel for any pulsations, and it is not bounding or anything, just a normal pulse here. So now I am going to listen for a bruit with the diaphragm of my stethoscope. So Ron, you're going to feel my stethoscope here, okay?
Mm-hmm.
Okay, very good. So next, what I'm going to do, like I said, I would have done that from the opposite side, had her turn her head to the right and done the same thing. Next, I'm going to move down to the middle of the chest. Also, on a normal patient, I would palpate down the center of her chest. I would start at the second intercostal space and move my way down to the fourth, feeling for any pulsations or any abnormalities with that. But I will not do that right now. Next, I'm going to listen. So Rhonda, you're just going to breathe normally, and I'm going to move my stethoscope across your chest, listening for any abnormal heart sounds, and I'm going to start with the diaphragm of my stethoscope. Okay, very good. So I don't hear any adventitious heart sounds, any abnormalities with that. Next, I'm also going to listen with the bell of my stethoscope as well. So Ron, I'm going to listen with the smaller side of my stethoscope, okay?
Mm-hmm.
Okay, very good. Now next, Ron, I'm going to have you sit up just at a normal height here so I can help you sit up a little bit if you need. And I'm going to do the same thing. I'm going to listen with the diaphragm and the bell of my stethoscope in all of the spaces again. Okay, gonna flip to the other side of my stethoscope. Okay, very good. And now, Rhonda, I'm just gonna have you lean forward a little bit, okay?
Mm-hmm.
Good. And I'm gonna do the same thing, listen in all the spaces again. Flip to the other side. Okay, very good. So now that will complete the cardiac exam. Ron, I'm going to have you lay back, and I'm going to move on to the peripheral vascular exam. So first, I'm just going to inspect. During a normal exam, I would have her lift up her shirt so I could see her abdomen and look for any pulsations in the abdomen area. Right now, I'm just going to feel for any of that right above her belly button and feel for any pulsations there. Are you having any tenderness as I'm touching there?
No.
Okay, good. So I'm going to feel over toward the side. Feel for any pulsations. And I would also, in a regular exam, go down and feel the femoral pulses and feel for any abnormalities there as well. But I'm going to move on to her extremities next. So first, I'm just going to take a glance at her extremities, notice the coloration, notice any cyanosis near her fingertips or anything like that. I'm going to feel, my hands are cold, I'm going to feel and just feel for a normal warm temperature with her fingers and her arms on both sides. Not seeing any abnormalities there. I'm going to start with feeling her radial pulse here. So just go ahead and switch your wrist. Good. And then I'm going to move up to the brachial. And I'm going to do that on both sides as well. Good. Good. Okay, now I'm going to do the same things with the legs. Just going to look and feel, see for a normal temperature and coloration. Any pain in your legs, Rhonda, when I'm feeling like this? And I'm also going to check for any edema in her ankles or legs, if there's any pitting when I squeeze. Not seeing any indentations of my fingers there, so I'm just going to feel for her pulses here. Feel for her pedal pulse on both sides. I'm going to feel on the back here. Good. And then I'm going to have you bend your leg up a little bit, and I'm going to feel for her popliteal back behind her knee. Okay, I'm going to do your other side. Okay. Next, I'm going to check for the Holman sign here. So Ron, I'm going to lift your leg up a little bit here. I'm going to feel your calf, and I'm going to push this way. Are you feeling any pain in your calf?
No.
Okay. Good. Same thing on this side. Ready? I'm going to sit in here. Any pain here?
No.
Okay, good. Okay, so now that will complete my peripheral vascular exam. Next, I am going to have Rhonda get up to the chair here, and we're going to continue with the respiratory exam.
Forward.
So for right now, I'm just going to have you sit normal with your back against the chair here. And I'm just going to start by visualizing her breathing. Notice if she's doing any tripoding with leaning over while she's breathing. If her work of breathing changed from laying down to sitting up, everything looks to be normal with that. So Rhonda, what I'm going to have you do is actually swing your legs to the side here, and I'm going to start with the back of the respiratory exam. I'm going to start in the back. So what I'm going to do first is I'm going to feel down the back of her spine, and Rhonda, just tell me if you feel any pain while I'm doing this. So I'm just going right down the back of her spine, just pressing here, and noticing if she were to tell me that she's having any tenderness there.
No.
Okay. Now what I'm going to do is press. It would almost be where her kidneys sit here in the back. I'm going to press here. Are you having any tenderness there, Rhonda?
No.
Okay, good. Just going to move this over here. Now I'm going to come to the side here. Ron, I'm going to have, just take a look at your fingertips. I'm noticing for any clubbing in her fingernails, and I'm going to check the cap refill here as well. She does have fake nails on, so typically I would squeeze the fingertip and watch for the coloration to come back in less than 2 seconds, which would be normal for her, okay? So next what I'm going to do is I'm going to check for excursion. So what I'm going to do with that is right along the bra line, I'm going to stick my thumbs and wrap my fingertips around the side here. And what I'm going to do is pull up and squeeze a little bit of the skin, and I'm just going to have you, Rhonda, take a nice big deep breath. Good. So as my fingertips were like this and she took a nice deep breath in, I saw a nice extension. My thumbs separated and came right back to each other. So that is what we're looking for with that. Next, what I'm going to do is check for fremitus. So with that, what I'm going to do is I'm going to do a dual exam instead of doing each one separately. And I'm going to put my hand right here, starting at the bra line, And I'm going to have you say blue balloon, okay? So go ahead.
Blue balloon.
Good. Again.
Blue balloon.
Good. Again.
Blue balloon.
I'm going to go right here.
Blue balloon.
And then I'm going to have you stick your arms out to the side a little bit for me, Rhonda. Good. And say it one more time.
Blue balloon.
Perfect. So next I'm going to percuss. So with that, I'm going to stick my fingertips and I'm going to tap right on my middle finger and listen for any abnormalities with that. And I'm making sure to have my middle finger laying flat here and hitting right in the middle of my knuckle. I'm also going to do that up here as well. And then Ron, I'm going to have you lift your arms up to the side for me one more time. Okay. And over here. Perfect. So, to complete my respiratory exam now, I'm going to listen to the back here. I'm going to start at the base of her lungs, go across, and make my way up. So for these ones, Rhonda, I'm going to have you take nice deep breaths in, okay? So go ahead, nice deep breath in. Good, I'm going to move to the other side. Good. Okay, I'm going to move to the front here. Go ahead. And now lift your arms up again for me. Go ahead. And go ahead. Perfect. So now, Ron, I'm going to have you just swing your feet around back to the front. I'm going to listen to your lungs in the front again. Go ahead. Good. Now, as you're doing that, are you feeling short of breath at all? Do you feel like you're struggling to catch your breath?
No.
Okay. Now, do you wear any oxygen at home or do you have any issues with breathing at home?
No, I don't.
Okay, good. So I'm just looking as I also was listening to her lungs. I'm also just checking for a regular respiratory rate, noticing that she isn't having any increased work of breathing. I can't audibly hear anything. Her lungs were clear to auscultation, no wheezes, no coarse lung sounds. So that'll complete my respiratory exam as well.